Hi everyone, how are you? Welcome to another videos for MRCS exam. Here the questions. What is the boundaries of the shape triangle for the chest drain insertion? That means safety triangle of the chest. Here, through the intercostal chest drain tube was inserted into the pleural cavity. So here we can see what is the boundary. It is the direct question of the safety triangle of the chest drain insertion. So here the options, it is bounded by the trapezius, latissimus dorsi and vertebral border of the scapula. This is first option. Second option, bounded by latissimus dorsi, pectoralis major, line superior to the nipple of the apex of the axilla. Another. Then third option, bounded by latissimus dorsi, serratus anterior and line superior to the nipple and the apex of the axilla. And the fourth one, bounded by the trapezius, deltoid, rhomboid major and teres minor. And fifth number option is bounded by trapezius, deltoid and latissimus dorsi. So we have to find out one of the option which gives the boundaries of this safety triangle. So here we can see a triangle which is located just below the axilla, and here we can see this is in triangular space. Then this triangular space, if we see the diagram here, the pectoralis major lateral border, that means anteriorly lateral border of the pectoralis major muscles, and posteriorly we can see this is the anterior border of the latissimus dorsi muscle, and the lower part at the level of the nipple. So it is the boundary of the safety triangle. Anteriorly pectoralis major, this is very important, pectoralis major, which is all of the chest muscle. Then posteriorly is the latissimus dorsi, which lies in this area, and the below it is level of the nipple, that means in the fifth intercostal space and above the six ribs. So this point is very important, fifth intercostal space and above the six rib. This two number is important because nipple usually located at the level of the fifth intercostal space, and fifth intercostal space, it is the above of the six ribs. So if the rib if they denote it is the ribs, then it is six ribs, and if they denotes it is intercostal space, then it will be the fifth intercostal space. In the second picture we can see easily here this triangle of the safety. It is the triangle, and this triangle here, the muscles, we can see the anterior border, it is formed by the lateral border of the pectoralis major muscle. This large muscle, it covers almost all of this chest here. This is the pectoralis major, and posteriorly there is another muscle. This muscle is the latissimus dorsi, and here we can see this is the fifth intercostal space, the fifth intercostal space at the nipple level, and fifth intercostal space, it lies above the sixth rib. Here in this picture we can see again, this is the pectoralis major muscle and latissimus dorsi and fifth intercostal space and above the base of the axilla or axilla. So this 3 point is very easy to remember: anteriorly pectoralis major, posteriorly latissimus dorsi and fifth intercostal space. So here it is bounded by the latissimus dorsi, pectoralis major, line superior to the apex of the axilla. This 3 point, posteriorly it is latissimus dorsi, anteriorly pectoralis major, and line at the apex of the axilla. So we have to remember this point very cautiously, and it is a repetitive question in the exam. Thank you all.